Hand washing is performed when the hands are visibly soiled or feel dirty, or when you're dealing with bodily fluids and blood. You need to perform hand washing for a minimum of 20 seconds. It's important to make sure you're washing the palms of your hands, the backs of your hands, get your thumbs in between your fingers and under your fingernails, up to the edges of your wrists, and to get the side of your hands. And then when you're done hand washing for a minimum of 20 seconds, you dry your hands with a clean towel. If the tap you're using is not an automatic tap, it's important that you use the clean, dry towel to turn it off, not your freshly washed hands. Using an alcohol-based hand rub is the second form of acceptable hand hygiene. So you can use this as an alternative to hand washing. It is equally effective. And similar to hand washing, you're going to perform an alcohol-based hand rub for a minimum of 20 seconds. You want to ensure you're covering all surfaces of your hands, just the same as you would when you are washing your hands, in between your fingers, around your thumbs, palms, backs of your hands, up near your wrists. And you're going to continue rubbing in the alcohol-based hand rub until your hands are completely dry. PPE plays an important role in preventing transmission of infectious diseases from both patients to healthcare workers or from patients to other patients. So there's different components of PPE and they play a different role. First, we're going to talk about gloves and gowns. These are a component of contact precautions. So these PPE items are going to protect the healthcare workers from pathogens that are transmitted by direct contact with either the patient or the patient environment. Next, there are face masks, which are a component of droplet precautions. So masks are used to protect the healthcare workers from pathogens, which are larger particles, like droplets, that are generated by either talking, sneezing, or coughing. And then finally, there's either face shields or eye goggles. These are going to protect healthcare workers during procedures that are likely to generate splashes or sprays of blood or other bodily fluids. All of these components together work in tandem to prevent transmission of infectious disease. When you start to don your PPE, the first step is going to be hand hygiene. So you can either use an alcohol-based hand rub or you can wash your hands. You're going to wash your hands if they're visibly soiled or dirty. If not, you can just use the hand rub. And it's important to do this for a minimum of 20 seconds. Okay, after your hand hygiene, your first step is going to be putting on your gown. So we have the gown here. You're going to put it on. Okay, once your gown is on, you're going to put on your mask. Now this mask comes with a face shield. Other masks, you might do the mask and then the eye protection, which would be a pair of goggles, but for this one they come as one. So you'll place the mask up to your face and tie it securely in place. Once the mask is tied, you pat it into place on your face, but don't pinch the bridge of the mask onto your nose, and then pull it under your chin. And then the last step is going to be putting on your gloves. When you're putting on the gloves, you want to make sure the cuffs of the gloves are pulled over the cuffs of the gown. Okay, so the first step in doffing your PPE is going to be removing your gloves. So you're going to grab one and roll it downwards into a ball, and then place it in the other hand. Then insert a finger into the edge and pull this off, and then drop it into the garbage. Next, you're going to perform hand hygiene. This would be performed for a minimum of 20 seconds, but just for the sake of repetitiveness, I'll just do it quickly. Okay, once you've performed the hand hygiene, you're going to remove your face mask / shield. You're going to untie the ties, making sure not to touch the front of the mask, just the ties. And then you're gonna lean forward and drop it into the garbage. Then you're gonna perform hand hygiene again. Remember, in reality, this would be for a minimum of 20 seconds. And for hand hygiene, it can either be the alcohol-based hand rub or hand washing. Okay, next you're gonna remove your gown. It's important that you undo the necktie first to avoid bringing a contamination up from the waist tie up to your neck and therefore close to your face and mouth. So undo this tie. And then undo the tie around your waist. And then you're gonna pull the gown down, pulling it inside out, and roll it up with the inside layer of the gown to the outside, and then put it in the garbage. You'll then perform hand hygiene one final time for another 20 seconds. And then you are good to continue. And that is how you doff PPE.